can't go back to what we had before, where we were saying there are millions of children who are just going to have to wing it and make it somehow. We're not going to provide them that extra cushion. In America, we can say that every child will at least have that meal.
Hi there, it's WAMC News Director Ian Pickus. And on this episode of the WAMC News Podcast, I speak with the head of the Robert Wood Johnson Foundation, Dr. Richard Besser, and the CEO of the American Heart Association, Nancy Brown. Well, the two organizations are warning of a looming food shortage for millions of children in the coming school year if Congress doesn't take action. The reason is the end of pandemic-era child nutrition waivers that funded free meals for students at school. I spoke with Dr. Besser and Nancy Brown on Wednesday. To begin with, what is the problem as you see it that you're warning about as we speak?
Well, I will say that, this is Nancy, that we know that school meals are essential, especially for those living furthest from economic opportunity. And we know that helping children grow up healthy is really important to their future and to the future of our country. Child nutrition waivers are responsible for an additional 10 million children getting healthy meals at no charge. And we know that this legislation that was recently passed by Congress extends those waivers through the summer, but a looming crisis does exist if these waivers are not extended through the 22-23 school year, because we need to assure that all children can receive healthy school meals at no cost.
And I'll direct this question to Dr. Besser now. Briefly, if you can, what is the correlation between good nutrition in students and good childhood health outcomes?
Yeah, I mean that's a great question. I'm a general pediatrician, and one of the things that we know is that children can't learn if they're hungry. And as horrendous as this pandemic has been, one of the bright spots is that early in the pandemic, Congress came together and said, you know what? We want every child in America to be at least guaranteed one good meal every single day. And they extended the school lunch program from just providing lunch to children at a certain level of income to saying every child in America will get a free school lunch. It removed the stigma from families having to apply, but it also cut down on what we describe as food insecurity. That idea that some days families don't know where they're going to get enough money to put food on the table for their entire family. And that ensures that children who are in school learning have what it takes to be able to focus, to learn, to develop, to reach their potential. And we can't go back to what we had before, where we were saying there are millions of children who are just going to have to wing it and make it somehow. We're not going to provide them that extra cushion. In America, we can say that every child will at least have that meal.
I'll put this question to both of you. So you're saying the pre-pandemic setup in America where, there are separate tiers of students depending on which school district they were in and depending on their family's means, that sort of decided who got reduced or free lunch in schools. You're saying that didn't work.
Well, let me just jump in and say that, 23 million families are experiencing food insecurity, and providing these school lunches for children, healthy school meals, has made a tremendous difference in the health and well-being of kids in this country, reducing, as Dr. Besser said, reducing the stigma, the process of application has reduced administrative burden. So providing school lunch availability and healthy food in schools for all children in this country is critical for the future of this nation.
Yeah, I mean, I was just going to add, in New York State alone, over 1.5 million children have benefited from these school lunch programs. And, when you look at all of the things we spend money on as a nation, the amount of money it takes to ensure that children aren't hungry is minuscule. And it's something, you had said, you had raised the question, did the school lunch program not work? It did work. But this iteration, this way of doing it without requiring the administrative burden of proving qualification or eligibility without requiring that stigma of a child coming forward to have to say, my family doesn't have the income to be able to provide this. By giving it to everyone, it's a much better program.
I'll put this question to both of you. We're in a different phase of the COVID emergency now. Schools are, planning to be back in person. The shutdowns of 2020 are in the rearview mirror right now. So this particular program was born out of a state of emergency in the U.S. Why should the waivers be extended if we are, in fact, in a different phase of where the pandemic stands now?
Well, I would say we're still in a state of emergency as it relates to the health and well-being of our children. The fact that 23 million families in this country are food insecure, the fact that 10 million children are getting healthy meals at no charge. The fact that so many families, are not able to appropriately feed and have nutritious food for their families is a crisis. And as Dr. Besser said, for a relatively low cost, we can make sure that America's children are fed. They are fed with nutritious food that can allow them to learn and prosper and grow and become the future of this country.
I think Nancy hit it beautifully. There were a lot of schools that would have struggled incredibly had they not gotten the enhanced payments from the federal government to support these programs. We're seeing story after story about the rising cost of food in America. If this program is not extended in full, we will see families having to make the choice between putting food on the table and paying rent. And we should not allow that to happen.
Some states have done this on their own, and some school districts that we cover here in the Northeast. I mean, Springfield, Massachusetts comes to mind. Every student gets free lunch there. What would you say to the idea that, states should figure it out for themselves and every state has a different need?
What I would say to that is, why as a nation should we say that the state you happen to live in, whether it's a state that is a higher income state or a lower income state, the state you happen to live in should determine whether or not children in that state go hungry. We don't have to allow that. Unfortunately, we accept that in so many different spheres of our lives. The state you live in may determine whether or not you have health insurance or health coverage. It may determine the quality of your schools. But what we're saying here is that it shouldn't determine whether or not your child goes hungry.
What is the deadline for congressional action?
Well, these waivers, expire in the coming months. And so in order for our children to continue to be fed, we need these waivers to be extended beginning September 1st.
I ask because, typically the time we're speaking now, July and August, is not a busy time in Congress. We've got an August recess fast approaching here. How confident are you that you'll see what you want to see?
I think that we saw bipartisan support of the extension of these waivers through the summer. And, we need Congress to act. And that's why we're talking with you today. It's very important to get the message out that Congress must act to protect families and children in this country.
Yeah, this is one of those areas where there is bipartisan support. And it's important, I think, to push back against the narrative that Congress can't get something done, because they demonstrated with the extension of these waivers through the summer that where there's a will, there's a way. And we truly believe that if Congress believes that the health of children is important, they can get this done very easily.
We've been speaking with Robert Wood Johnson Foundation CEO Dr. Richard Besser and American Heart Association CEO Nancy Brown. Thank you both very much for taking the time to speak with us.
Thank you.
Thanks so much, Ian.
All right, that does it for this episode of the WAMC News Podcast. Thanks so much for listening. Until next time, I'm Ian Pickus.